glorious truth along. It has never lost its power. It will never lose its power. It will never lose its power. The blood that cleanses from all sin will never lose its power. It will never lose its power. It will never lose its power. The blood that cleanses from all sin will never lose its power.
Morning, church. We want to appreciate the Lord once again. This time last year, we were gathered here and we did head talk on hypertension. So I want to appreciate the name of the Most High God has spared our lives, even though the situation in the country is not appealing. But we appreciate the name of God because He has granted us the opportunity to be alive. And we say, may His name be praised forever in Jesus' name. This year, we'll be talking about our oral health. And like I said in the first service, that despite that the system in Nigeria is no longer working, and which I believe it will still work in Jesus' name, I know that our systems are working because we have different systems in our body. So I want to pick one of the systems today to talk on. And the system is digestive system, in which the first point of call is the mouth, the oral cavity. So I want you to tell your neighbor sitting beside you that I believe your system is working. Your teeth is working. Abi is not working. Now begin to tell your neighbor all things that they do with their teeth, their mouth. You can talk with your mouth. You can bite with your teeth. You can break bones. Begin to tell them. Okay, let us personalize it. I can talk with my mouth. Because it is not everyone that can talk. Shall we know that? I can break bones with my teeth. Bring any bone I can crush. Then I can cut with my teeth. It's only those that cannot cut with their teeth. They don't talk. But if you can cut, please say it. And I can chew with my teeth. This is a great grace. Because not everybody can do this. So for this, we appreciate the name of God. The name of God. And for this, I want to read a brief citation about our guest minister for this morning. Dr. Jesutofunmi Soda Omilani. Jesutofunmi believes everyone deserves a beautiful, healthy smile. She is committed to helping people live longer, healthier lives by bridging the oral health information gap and providing hands-on solutions to oral health issues in Nigeria. This passion birth Smile Filter, an oral health promotion initiative through which she is helping caregivers being intentional about their health and their children's health. Her happy places are serving people, crafting, and reading. She is married to Olaoluwa Omilani, together raising God's general. Irea Yomitide Omilani. I think I am going to borrow that name too. My name now henceforth is Irea Yomitide Ayomo. So ladies and gentlemen, please let us jam our hands together while I welcome our doctor, Dr. Mrs. Jesutofunmi Omilani, to the podium. You are welcome, ma'am.
Good morning, church. We are cold. Is it because the weather is changing? First service too, we're cold, but second service should have warmed up a bit. Good morning, church. Good morning. It's an honor to be here this morning. I'm delighted to be part of your service, and once again, I appreciate the Reverend in charge, the pastors, deacons, elders, and everyone here present, and other ones too that may not be here, and those that were around during the first service. We had a great time first service, and I'm hoping that we would have a very swell time in second service. So before I start, just like I did in first service, we are going to have a very simple activity. Just like we give a wave offering to the Lord, we give a clap offering to the Lord. We'll be doing something different this morning. We'll be giving a smile offering to the Lord. It's not to me, it's not to the Reverend in charge, it's not to the pastor, it's not to Ms. Ayomo, it's to the Lord. So just your beautiful smile. It's not that hard, it's simple. Let's smile. I know you are pressured. There's stress in Nigeria, but smile. When it's easier said than done, and say when you are going through something, when you are pressured, that you smile through it. But how many of us truly smile to it? So let's practicalize it this morning, so that it become a part of us that at any time we'll be able to smile. Oh yeah, just 5 seconds to smile. Just 5 seconds to the Lord. Let's smile now. It's like the men are not smiling. The daddies are even smiling. It's the young men that are not smiling. Okay, thank you. Thank you for giving a smile. So now let's give a clap offering to the Lord. Okay, thank you so much. So, how do we feel? Okay. So if I were to sample different opinions this morning, it will all vary, but it's one feeling that we all have. Is a good feeling, because our smiles are very powerful, but sadly we underrate it. Our smiles can do a lot. Just smiling to your neighbor. Maybe I should say you should do that. Smile to your neighbor. Smile to your neighbor. Some people are not smiling to their neighbors though. Like some who don't like their neighbors in this church. Smile to your neighbor. Okay. Just smiling to your neighbor can uplift his heart. We have all come to church with different emotions. Some have come here happy. Some have come here weary. Some have a lot that they are going through. And just smiling to your neighbor, just cultivating an habit of when you get to work, you smile to the person you meet. Getting to a bank, you smile. I know that sometimes we can get frustrated for different reasons, but a smile does a lot. A smile eases stress. A smile uplifts us. When we are stressed, a smile is a stress reliever. And our smiles are beautiful impression makers. What do I mean by that? You can go to a place and all the person remembers about you is your smile. You may need to close a deal and say, oh, that lady, that man, that woman that smiled, please call him back or call her back. Let's close that deal. That's how powerful our smiles are. So I want to encourage us that we should keep smiling. So if there's anything you leave here with this morning stroke afternoon, let's remember to always smile. It is well with our souls in Jesus' name. So our focus this morning is on our mouth, which will impact our smiles. So how do we care for our mouth? Are we intentional about our mouth? All these things will tell if we'll be able to smile brilliantly, we'll be able to smile healthy. And our mouth again, which makes us smile and makes us do a lot of things. We speak with our mouth, we eat, we use it to drink. There are a lot of things that we do with our mouths. It's a very powerful, amazing weapon, but it's underrated. It is mostly underrated. If I were to sample how many people that have ever been to the dentist or go regularly to see a dentist, I will not want to embarrass people this morning, but I'm sure that more than, I'm not sure I'll be able to get, I'm not sure half of the congregation will raise their hands. And it's, this is so because oral health information is pretty limited in Nigeria compared to advanced countries, but it's getting better. And it's a privilege to have this kind of discussion, especially in the church setting. And I'm glad that the churches are beginning to embrace this kind of conversation. Mostly just people get to know a lot of things about their health only when they get to the hospital. But it's good that we are having health weeks, health talks now in the churches. So this mouth that we least care for, I think one of the reasons we don't rate our mouths is because we think it's a separate entity. We think Shebeni would wear lovely clothes, would put on a nice cologne, would wear lovely shoes, lovely high spec like mine, and we do other things. But when we are going out in the morning, we just and we just as we just get out of the house, we are rushed up when it comes to our mouth, but we take our time to bathe, to dress good, to put on a good makeover and all. And this shouldn't be so. The mouth is not a separate entity. It may seem small, but it is mighty. So our mouth is small and mighty. So let's say my mouth is small but mighty. It does amazing things. Thank you. So the mouth is interconnected with the whole body. It's not a separate entity. So the mouth, I see the mouth as a gatekeeper, and I also see it as a window. So this is what I mean. The mouth is a gate to the body, because what do gates do? Gates shields. For example, this building, the church building has a gate. And when your services are on, or if you have other programs, the gate is open for people to come in. But when service is over and there's really nothing much going on in church, what do? The gates are locked. So they serve as protection from the outside, from strangers, from just anyone coming in. You want to know who is going out, who is coming in. So that's what the mouth too is like. We give permission to what we drink. We give permission to the things that go in. We also give permission to things that come out. With the utterances we speak, how we choose to socialize, how we choose to talk with people. Also as a window, when you look out of the window, you see buildings. We all see different things. I may look out of the window and I appreciate the lovely tree over there. I look out of the window, I'm seeing an uncompleted building. We would all see different things. So that's what the mouth too is. The body can present different things into the mouth. A good example is when we are very stressed. When we have overworked, we have just been working back to back, and we don't take time to rest. We have sometimes and our immune system is down. We can come down with mouth sores, which Yorubas called majata. Mouth sores can come in varying degrees, but mostly those very tiny ones is as a result of stress, extreme stress, being overworking yourself, or you have not been eating the appropriate, maybe you are the type that just likes eating carbohydrates. You don't eat, there's no effort, so you're not putting anything. So that's nutrient deficiency can also cause something like that. So that's what the body does. So the body and the entire body with the head, they work hand in hand. Also, in individuals that have diabetes that's not well controlled, it can present in the mouth as pimple-like swellings, which you call abscesses, call them periodontal abscesses. And the dentist may be the first person that would detect that this individual has a high blood sugar. The person may not know. The person may be going about his everyday life and all is well, he's sleeping, waking, eating, doing all things, and just I just have these recurrent swellings that just come and off. That may be the first sign. But if another person is not knowledgeable, like maybe not a dentist, may not know, may just it's infection, but the individual would not know that he or she has IBM. That's just an example. And also for people who, that are not even intentional about their oral health. There are people that don't brush. It's difficult to believe, but there are people. I've actually met someone that told me that he brushes once in a week. And I was wondering that, is it a case of maybe he could not afford to buy toothpaste or to buy toothbrush? He just said he just believes that he doesn't want to wear off his tooth. So he needs to be maintaining that tooth. So he chooses the day of the week, maybe a Friday or a Saturday, and he will just dedicate that day to thorough brushing. Then we'll meet his toothbrush and his toothpaste, they make another appointment the next week. So it's, it's difficult to believe, but it's a reality for some people. So for a person like that, the mouth is home to bacteria. And there's nothing we can do about it. These bacteria are harmless. They are what we call normal flora. They have what they do in the mouth. But when there's a compromise, they can become opportunistic and become harmful. So when they become opportunistic, it can go into the bloodstream and can affect other organs in the body. For example, it can go to the heart and can be contributory to what a heart infection called endocarditis. It can contributory to the lungs and can cause something called pneumonia and some other respiratory diseases. Also, when there's chronic peptic ulcer, for those that have, there are people that come down with pain from their stomach, people that have chronic liver diseases, people that have chronic kidney disease, they may have this unpleasant smell that comes out of their mouth when they open their mouth. Though that's not the only reason. So, so next time you probably meet someone and the person opens his mouth and there's this off smell, it may not be because the person has a systemic illness, but it could also be a pointer to a systemic illness in the body. Because one of the commonest causes of mouth odor or unpleasant smell from the mouth is poor oral hygiene. So going on. So this is just to highlight, in summary, I'm just saying that how well you care for your teeth and your gums affect other parts of your body. And how well you care for other parts of your body would also in turn affect your mouth. So this is to highlight the importance of oral hygiene. Oral hygiene is just the practice of caring for our teeth and our gum in a safe way. So what's our part to play as regards mouth hygiene, as regards oral hygiene, as regards caring for our mouth? So what we give priority to, we pay attention to. So if we see it as important that we need to care for our mouths, we would be intentional about it, even when it's not convenient. There are things that we do on a daily basis. Nothing is convenient in life. One has to make certain sacrifices or make certain compromises to get things done. It's never easy to wake up in the morning and get out to go to work, to have a bed. It's never easy to do certain things. Sometimes it's never easy to eat, yes, but you know you need the food, you need water to keep your body going. So what we place, so the starting point is making a decision that my mouth is a priority and I'll care for it. Secondly is arming yourself with truth, which we are learning this morning and putting it to practice. Because it's one thing to arm yourself with knowledge, and it's another thing to do it. We will not just be hearers of the word, but we'll be doers of it in Jesus' name. Then, thirdly, is getting the right tools. I know if I ask everyone here, we would all raise up our hands that we brush, we do certain things, but are we using the right tools? Are we doing it the right way? So those are the things I'll be talking about. So how do we now maintain oral hygiene? These are not things that you are not used to. Maybe for some, you may not be familiar with, but this is like what you do every day. Brushing our teeth every day. And everyone should clean his or her mouth from babyhood to adulthood. So babies are not exempted. For mothers that have little babies or little kids, please, they need to clean. The early they start, it's kind of said when an habit is formed and becomes a part of them. When they start early, there are little chances that they'll come down with holes in their teeth or have tooth problems. It has been discovered that children that have tooth problems early are likely to have tooth problems for the rest of their life if they are not intentional about certain things. So we have to brush our teeth twice daily, in the morning and at night. And the night brushing is actually the most important one. I know everyone, does it mean I have to go out of my house without brushing? No. You have to brush your teeth so that you have a fresh breath and you will not, we will not be wondering, what is this off smell? You will not feel comfortable. But the night brushing is very important. During the day, you eat, you drink, you are talking, you are doing a whole lot of things. But at night, your mouth is closed, you are not eating, you are not drinking, you are not talking, you are in a subconscious state. When the daily things, the eating, the drinking, and talking helps a free flow of saliva. But when we are sleeping, the salivary flow in the mouth reduces. And saliva has some buffering ions that help to keep our mouth clean and help to give protection to our teeth. I will come back to that. So, sugar that we take every day, we all take sugar in different forms. So sugar is not only in our biscuits, in the chocolates, in the drinks. The carbohydrates we also eat convert to sugar in the body. So the bread, the rice, the eba, the fufu. So sugar can be a friend and can be a foe. So as a friend, it gives you energizing capacity, serves as a building block, and does a whole lot of things. But as a foe, when you take in sugar and you are not cleaning, you are not rinsing, you are not brushing, you are literally not doing any, or you are not doing it the right way. Bacteria. Remember earlier I said that our mouth is home to bacteria. They are harmless. But when we eat these things, they feed on this bacteria. The bacteria feed on the food particles that are left in our mouth, and they multiply. The byproduct of this process is acid. And what does acid do? When acid is on anything, whether it is on the skin, even on the floor, it wears off that place. So when there's and this process happens in our mouth all day. There's nothing we can do about it except what we need to do to ensure that the acid flow is continuously neutralized. So when acid keeps wearing off the tooth, that's when people come down with holes in their teeth, or what Yorubas call akokoro. That's curious lesions on the teeth. So we need the brushing. How we brush is important. Because a lot of people, I've found that a lot of people just brush haphazardly, except a few that are intentional about how they brush. How you brush is important. It's expected that you start cleaning your baby's tooth from birth or within weeks of birth. It may not be very realistic and feasible to clean your baby's tooth from birth, because as a new mom or a new dad, you are trying to settle in with the pressures of caring for a child. But within 2 weeks, 3 weeks from birth, you need to start cleaning. And what do you need? You just need a gauze. There's this, the gauze that is used by medical professionals, by health professionals. Gauze, it looks like bandage, but not bandage. It's sold commonly in pharmacies, sold in some supermarkets. You just need a little portion, a clean finger. You wrap it around a convenient finger, and you clean the gums and the tongue morning and at night. There are also there's also some prepackaged products that is brought into the country. They are called dental wipes. They look like regular baby wipes, but they come in very small packages. They come in wet. For the other one, you would have to wrap it and dip your finger into water or pour water on your finger to clean. But that, you just wrap around a clean finger and you conveniently clean morning and night. And as the child transitions to solid diet, that's from about 6 months, 7 months, you want to, around that time, some children have started erupting their teeth. Their first incisors are out. You would want to change to a finger brush. A finger brush is like, sorry I didn't remember to come with it. It's like, it has this silicone body with little bristles. The silicone aspect is used to clean the gums. The bristle is used to clean the teeth. And for children under age 1, please no toothpaste, just water. It is a little controversial. Some literature will say 1, but literature will say 2, but it's from 1, it is still safe to start using a little toothpaste. But under 1, please no toothpaste, just water. Then as child transition from 1 to 2 years, you can still keep using your finger brush, or you get a small brush that is fit for the child's mouth, because we have different sizes of mouth. So that is fit for the child's mouth. Just a smear, not pea size. I know we probably have heard pea size. Pea size is not for children under 4 years. A smear. You just like you bring out, when you press your toothpaste tube, it's like you are rubbing the paste on the brush. You are not spreading it from one corner to the other. So that's for children under 4. The reason is, at that age, a lot of them are not spitting out. So when you brush for them, they swallow whatever you brush. And you don't want to compromise their systems, allowing them to have stomach upset. And you also don't want to compromise their adult teeth when it will eventually come out. You see that there are some individuals that when adults, they have these supposedly white teeth, but they are not exactly white. It has like a whitish stain. That's a result of excess fluoride that may have been taken from toothpaste, or if they lived in areas back in the years when we had public water that were treated with fluoride and they took a lot of it, so they have this whitish patch. So that's a result of fluoride. So for adults, it's expected that you use soft or medium bristle toothbrush. When you buy a toothbrush, you see soft on it, you see medium, you see hard. Hard is for nobody. Hard is for your airbrush or your shoe brush. Hard compromises your teeth, it compromises your gums. It causes your gums to recede like a person that has a bowed head. So when you keep using hard brush, you do a lot of damage, and if care is not taken, your tooth can become loose because you are gradually taking off all the attachment, all the supports to the teeth. Then you're supposed to brush twice daily for 2 minutes. I will explain how we'll do for 2 minutes at the time of demonstration. I will just keep talking at the time of demonstration. It's possible. I know I've said 2 minutes. How do I time it? It's possible. I will demonstrate that. Then you're supposed to, another way to maintain good oral hygiene is to rinse after every meal. I said earlier that food particles are left in your mouth after every meal, whether you eat biscuits, you eat rice, you eat bread. Those little particles are the ones that these bacteria. So you want to reduce their chances of compromising your teeth. So after every meal, just put a little water in your mouth. You can swallow it or spit it out depending on what is convenient for you. Then we are also supposed to floss at it. There's this, I would also show that in the demonstration session. There's this plastic, there's some that come in thin threads, some that come in plastic and has this whitish thin thread. That's called a dental floss. You're supposed, there are areas of your mouth that your brush cannot get to, in between your, so the floss is supposed to help you clean. If you have, I'm sure a lot of us have it and maybe are not using it. If you get home today, just put that floss in between your teeth and just put it close to your nose. You will see that it has this foul smell. So your brush, you are cleaning, but you are not cleaning in between your teeth. So if those particles stay there, the chances are high that there will be issues with your teeth over time. Then drinking water. The need to drink water cannot be overemphasized because we need water to to go about our everyday life. There's a feeling when you get very dehydrated, you feel your energies are down, you feel very weak. That's one of the things dehydration can cause. But it's not only for your body system. You also need water for your oral health too. And what does water do? Water helps to keep your mouth moist and to keep your salivary flow continuous. And I said earlier that saliva has some buffering ions that help to neutralize the continuous acid that is produced in the mouth. So we need to make a conscious effort to drink water. I used to be like that many years ago, but I'm not yet there. But I've progressed beyond where I was. At the time I started drinking water, I had to consciously setting alarm. We set alarm to wake up. We set alarm to do different things. We can set alarm to drink water. So if I wake up averagely 5 a.m. in the morning. I take a cup of water. I get to work around 8. I take another cup of water. By 10, I take another cup of water. It doesn't have to be too much, just little at a time. You realize that you would stay active and your energies will be up throughout the day. By the end of the day, it's recommended that you drink at least 2 liters. You will realize that you may even have drank more than 2 liters of water in that particular day. If you are not using cup, if you like to take pure water, you can take one pure water at a time. Or if you take bottled water, whether 50 cl or 75 cl, you can take half at a time. If you can take a whole bottle, take a whole bottle, depending on what is convenient for you. Then sugar intake. Reduce sugar intake. And I said that the sugar intake is in different forms. And we are in an environment where we take a lot of fizzy drinks, like Coke, Fanta, Sprite. Even the juice that we take have high sugar, and these drinks too also contain some form of acid, citric acid. Some people like lemon, some of us like lime, some of us like to take grapes. It's not like these things are in entirety bad, but they have their impact on the teeth. For example, for those that take lemon, and there are people that have an habit of taking lemon every morning, the more intake of lemon that goes in, it affects their teeth. The tooth is made up of 3 layers. We have the enamel, that is the outermost layer. We have the dentin, and we have the pulp. So the outermost layer keeps wearing off because whatever acid touches, it wears off. So if you keep taking citrus drinks over and over and over and over and over and over and over, it can wear it off. But there's another way to take it. Instead of putting your cup directly to your mouth or bottle directly to your mouth, as much as possible, use a straw. When you use a straw, it goes directly to your throat. If you are using it for weight loss, you are using it for energy levels, whatever function it needs to serve, it will still serve that function, but you will protect your teeth. And the body also works hand in hand with the body. So we also need to exercise. It's recommended that we exercise 150 minutes every week. How can you do that? You can do like the exercise. When people exercise, we think it's difficult. Exercise shouldn't be difficult. Exercise can be as simple as just walking, bricks walking, dancing, doing your daily activities at home. The goal is that you sweat and you pants that you are a bit breathless. That way you have achieved. So it's recommended that you do 30 minutes of light exercise 5 days in a week, or 50 minutes of high intensity exercise 3 days in a week. As much as exercise is important, it's important that we don't also overdo it and overstretch our body. Our checkups for women, for men, checks up vary. We have the breast examination, cervical screening. For men, we have prostate screening. We have different checkups. It's important that we have a thorough checkup at least once in a year. Then knowing our numbers. Knowing our numbers is very important. We know, a lot of us here know our passcodes. We know our phone numbers. We know a lot of numbers. We even know some people's phone numbers of it. But if we are asked that, what's our blood pressure? Maybe like, nothing's wrong with me, I don't know. What's your blood sugar? I don't know. What's my BMI? I don't know. It's important that we know your blood sugar. And gone are the days where diseases are now that of age 40. You know, there's a lot of disease that they'll say from age 40 and above. 20-something-year-old people now have hypertension. Even children in adolescence are coming down with it because our trends have evolved. The world keeps evolving. We are not in the regular normal that we used to be. We are in a new normal. Not even before COVID set in. We are in a new normal of different things. So it's important. So it's not for parents here that may have adolescents, that may have children. It's important that they also have regular checkups from time to time. Then reducing your stress levels. I know Nigeria is very stressful. We all experience stress in varying degrees, but as much as we can, it's important that we rest. Rest is another thing that we mostly underrate. You just keep going and going and going. But the truth is that when your body breaks down and you are probably down with malaria or you have pains in your body, the things that you consider important will take a break. And you will not consider them important until your body starts working optimally. So let's take time to rest from time to time. Okay, one thing I left. As regards the paste, for adults, we don't need to put our paste from Bristol to Bristol. This is what I mean. We don't need to fill the whole Bristol with paste. This is a big toothbrush, but our toothbrush is smaller than this. We just need like half of the Bristol. This is the reason. When we brush, ideally, we shouldn't rinse. We should just brush and spit out. There's fluoride content amongst other constituents in the toothpaste that helps to keep our teeth clean and healthy. When we rinse off, the fluoride has a strengthening effect. When we rinse off our mouth after brushing, we do not put any strength, we do not strengthen our teeth. It has no protection. When you brush and you don't rinse, there's a film that covers the film of your brushing process, covers every of your teeth and protect your teeth all day. So irrespective of any acid attack that keeps attacking your teeth, you are protected all day. Then you do it again at night, you are protected all night. But when you brush and you rinse, there's no protection. So the ideal way to do it is that before you start brushing, rinse your mouth. So if there's any debris or anything, it goes off. Put a little paste. Whether you use a smear, whether you feel from Bristol to Bristol, whether you use a little, The fluoride effect is not dependent on the size. If you think about it, why would you ask a child that probably needs more strengthening of teeth to use a smear of toothpaste, and an adult that your bones are strong, your immune system is okay and all, you now say you have to use a big part? The fluoride content will do its work, whether you use little or you use a large quantity. But what happens when you feel from Bristol to Bristol? You have the urge, you feel irritated and you want to rinse. But when you use a little quantity, you just have a little foamy effect in the mouth, you spit it out and you are good for the day. You can start it. When I started, I also grew up rinsing, but even when I was in dental school, I was still rinsing. But it got to a point I can't just be, I have to practice what I preach, so to say. And I've started, actually over the last 5 years, I've been doing it and have not had any tooth issue. Because tooth issue is not, doctors to remove their teeth. And also I want to should I correct a misconception. Dentists are not yoyin, as you call us. Yes, we remove teeth when the teeth is extremely bad and there's nothing we can do. We also treat it, but the problem is people don't come in early. That's why I say we underrate our mouths. This mouth, we underrate it. When we are having pain in the mouth, go and take antibiotics. We also live in a part that we abuse antibiotics. Just go and use antibiotics, use analgesic, and you are fine. But if something is wrong with your leg or with the hand, the speed we have malaria would literally be expecting that the doctor will get to the hospital even by 4 a.m. Except it's so bad that we have a bad toothache and we come early. So that's how we underrate our mouths. So, but please let's change. So if there's any changes in your mouth at any time, please let's make conscious effort to see the dentist. We also need to visit our dentist every 6 months. That's twice in a year. Every 6 months. And for those that have young children, if twice a month is not convenient or feasible, every time they have long holidays, like children are on long holidays now, that with long days between July ending August, make out time for them so that they don't, because when they come down with tooth issues, the adults or the parents will be the ones that will miss work, they will miss school, and sometimes dental appointments is not just come and go. You may have to go back to back until that issue is solved. So if you don't remember anything I said this morning, remember to brush, remember to floss. Remember that when you brush, don't spit, don't rinse. And remember to rinse after every meal and drink water. So a good oral hygiene will do wonders to your teeth, will do wonders to your gum. Our smiles are priceless. I believe that after today, we will not underrate our mouth anymore. We will cherish it. We will nurture it. We will flaunt it. By the time you get home today, some will be wondering that, why are you just smiling? Just that I'm flaunting my smile. They've told us to nurture our smile. I'm cherishing my smile. So thank you for having me this morning. So please, let's keep smiling. Every day, let's make conscious efforts to smile. Irrespective of whatever it is we might be going through, that smile alone can do a lot of wonders. Thank you. Sorry, I apologize. Demonstration session. So, this is what our brushing should look like. So this is our upper jaw, this part. This representative of our lower. This is a tooth model. The two big teeth in front are the incisors. These 4 in front. Then this is the canine. We have the premolars, 2 premolars, and for some people have 2 molars, some have 3. So we have for adults, for children you have 20 teeth, 10 up, 10 down. For adults, you either have 28 or you have 32. And with few exceptions, we have lesser than 28. So when you have 28, your teeth is still complete. When you have 32, it's complete. You didn't have the last one. Those that the Lord generously blessed are the ones that have 32. Sorry, I didn't say that. That's just on a lighter note. So how do we brush? So your goal is you want to brush away from the gum. So you position. Some people brush this way. It is wrong. When you do this, you compromise your gums and you can bruise your gums and gradually start creating holes that will eventually start losing the attachment. So you should brush away from your gum, like a sweeping movement. Like when you sweep away. You sweep away. So how do you now brush for 2 minutes? So assume this is my brush. I've rinsed my mouth. I've put a little toothpaste on my brush. So I do this. I do a counting movement. These 2 teeth in front divides the mouth into 2 halves. So you notice that the same set of teeth on one half is the same set of teeth on the other half. Same for the lower. So I would brush. This is one surface. This is another surface. And there's an inner surface. The same thing for the lower. This is one surface. This is another surface. And you have another surface. So 3 surfaces. So I'm expected to clean each surface for 10 seconds. There are brushes that have timers that after 10 seconds it beeps. But in our environment, we use the traditional brushes, this kind of brush. So you brush this way. So I count in my mind. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 seconds. The inner part. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 seconds. So 3 parts, 30 seconds. 30 seconds here, 30 seconds here, 30 seconds here, 30 seconds here. Making 2 minutes. I hope my math is correct. Okay. I'll get to the tongue. So this is the dental floss. Some of us have it in our homes. And some of us use this end. If you use this end, it's like using toothpick. And what toothpick does is that you think it will take it out. Toothpick is what we call musheya. It will take it out sharp, sharp. It will take it out fast, 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 fast. But what happens is that you gradually bore hole in your bone. And gradually microorganisms, food, other things will seep in and infection can happen. There are people that have this dull, trembling pain. It could be as a result of toothpicking. So this is what you should use, this thread. There are also some ones that come in a bigger pack that you just have to cut the thread off. But this is the commonly one that is sold. It's sold in pharmacies, supermarkets. So what you do with this is, it's not possible to floss all day, except maybe you have a meat. So it's recommended that you floss every night before your night brushing. So you take out everything you have eaten in the course of the day. So you just put it in between your teeth, gently, and gently clean out. Put it in between your teeth, gently clean out. Put in between your teeth, gently clean out. Your teeth, gently clean out. So you do that for all the teeth. After you have done that, do your night brushing. So for the tongue, when you clean your tongue, sorry, I didn't come with the tongue. When you clean your tongue, let's assume that this is our tongue. When cleaning your tongue, you want to try as much not to go too far to the back, because that can make you retch and make you feel like vomiting. So you stick your tongue out, and you do a in and out movement. In and out movements. In and out movements. The coated parts are always the outermost parts of the tongue. You don't need to go too far so that you don't throw up. So in and out movements. Some of us have brushes. This brush doesn't have it. That has these spiky things on it. Some of us have, there are some brands now that do it. Those spiky things serve as tongue cleaners. So if you have them, preferably use them. So turn your brush like this and do it. It will clean your tongue well. But if you don't have that kind of brush, and for one reason or another you did not get it, just use your bristles, just clean and spit out. That's what you can do every day.
If you are clapping, please let's clap very well. Thank you very much. Do we enjoy ourselves? And we have learned a lot of things. Please, do you have anybody that has questions? Questions? Okay, one from choir. 1, 2, 3. Mrs. Ogungbe 1, 2. Mrs. Alamu. Mommy Koka 3. Mr. Ahimode 4. My friend's husband 5. Mr. 6. 7. Okay. Do we make do? Okay. So we have 7 questions. Number 1.
Okay. So after the first service, when we finished praying, somebody was saying that is adding this aboki sound, this while brushing our tongue. Is it actually part of the good way of brushing? Like they want to remove all their all the stuffs in the throat. Then I also want to ask, because I remember that my elder sister, whenever she wants to brush, she will take the normal toothpaste on her brush, then she will add another one on her palm. Probably after brushing the first time, she will now take the other one again and then start brushing. So I don't know, maybe it is also part of the procedure.
I have 2 questions. The first one is, actually I am used to add brush. So whenever I make use of a soft brush, I'm not always comfortable throughout the day. So I'm used to it. So how can I go about it to go back to soft brush or medium? So second question, I want to ask that someone said, if at all you want to take water, you say water is good to take early in the morning when immediately you wake up. Can you take warm water or just take any water? So I want to know which one is better. Then the third one, concerning the mouth odor stuff, is it the tongue that actually bring about the smell or the teeth? So that's the question.
Okay, let me start with the retching. That's what I was explaining when I was talking about how to clean the tongue. In cleaning the tongue, you need to clean more of the outer. That's when you stick out your tongue. You have an inner area, you have an outer area. So it's the outer area that you should be more concerned about. When you go too far to the back, you activate a particular cranial nerve 9, and it causes you to retch, and some people throw up or you feel like throwing up. So you don't need to take your brush too far. Just cleaning the outer area is okay. Then as regards the brushing first, putting on palm, I think it's just maybe a personal routine. As far as she's doing it right, it's her choice. There's no implication on if you do it or you don't do it. I think it's a personal preference. She's just overzealous, or she wants to do more and ensure that her mouth is very clean. I think I've answered to okay. So ad brush is for nobody. Even for the commercials will say hard brush is for smokers. Even when we do outreaches for tobacco cessation and other things, we don't encourage the use of hard brush. If there's anyone that is even using hard brush for any reason, some of us take tea, we take coffee, bitter cola, and all those different things that can stain the teeth. We want to ensure that you don't stay on hard. You gradually transition from hard to medium. And for those that, for any reason, they feel the soft is too soft, you can do the in-between. The medium is not too soft and it's not so hard. It's just firm. So soft or medium is the appropriate toothbrush texture for an adult. Hard would further compromise it may not be now. It may be in years to come. You see that some individuals in Harmattan season, when air blows into their mouths, they start shaking. They have this shocky feeling. Or when they take very cold things or very hot things, they have this shocking feeling. One of the reasons is if you use hard brush or you use chewing stick and you are not using it correctly. We don't discourage the use of chewing stick, but it has to be done appropriately. Then for water, I think it's a personal preference. I take room temperature water when I wake up in the morning, and I'm fine. Once I take room temperature water and I go about my other things, it flushes my body system. I'm able to ease myself before I go to work. I like to ease myself, but I don't want to be at work and I'm feeling like except there's something else that is going on. So I think it's a personal preference. Whether you take room temperature, whether you take warm water, it will still have the same effects. The warm water you're even taking doesn't get to the tummy warm. The cold water that some people perceive is too cold, it doesn't get to the stomach cold. There are a lot of processes that go on that will stick. So whether you take cold, you take ordinary, just that in the morning, preferably take room temperature or warm. So it's a personal preference.
Thank you very much, ma'am, for the lecture.
Okay, the smell. Well, both. If you look at certain people's mouths, it's prominent. You see this creamish, yellowish, some people grayish things around their teeth. Some people's own are marked. You will literally see it that's food they have eaten in the past, but they are not also cleaning well. Everybody has it. I have it. But we all have it in varying degrees. So the more it accumulates, the smell, it come off with a smell. Then if that individual is not also cleaning the tongue well, come off it. So what needs to be done is for the person to have a cleaning session done called scaling and polishing. And the person would be told what to do to maintain it.
Thank you, ma'am. My very first question, you have answered it. But it is now that I'm hearing it from a dentist that I put it into practice. Somebody has told me that when I brush, I should not rinse. I didn't take it because I thought it is, it's dirty something. Why will I not rinse? He said, go and try it. But now that I'm hearing it from you, I will start from tomorrow.
Thank you, ma'am. From this
night to you, Omilani. And then, anyway, from this now I will try. God will help me.
Amen.
You said baby from below 1.
Yes.
We should use ordinary water.
Yes, ma'am.
But what about the glycerin that we always use? When we give birth, we use glycerin. Is it okay? Or
yes, I know that glycerin is sometimes even recommended as part of the hospital packs, but ideally glycerin should not be a everyday use.
okay.
Glycerin has a cleansing effect, but it's better if there is maybe a very thick coat of milk, or maybe there's a sore or something that needs to be cleaned. A baby's mouth is self-cleansing. So the cleaning you are doing is just to ensure that the cleansing is optimal. So they may not be need for, there's no need for glycerin, except you need to do a thorough, maybe a milk coat cleaning, or there's a saw or something needs to be done.
Then some people use only chewing stick. They don't use brush. Is it okay? Then let me say the last one. Ma. What causes, why do I put it? Enyikikon.
Tooth pain?
So, is it pain? But when you eat and the food gets to a part of the teeth, it's like you speed the food up.
Okay.
You know, work on your agbari, that kind of work.
Oh yeah, mister. Oh yeah, ma.
So is it the peeling off of the outer layer that causes or what? And that pain goes off, goes on, and so those are the two questions, ma'am.
Okay. Let me start from the last one. Tooth pain can be as a result of different things, and they are in various degrees. If the tooth is exposed, I talked about the enamel, the dentin. The dentin is like an open tubo that contains the nerves. So if something of hot food, cold, extremely cold, or sometimes even sugary things touches that area, you may have this pain sensation. For some, it will just linger for a little while. For another, it will linger for hours. They may not be able to do anything throughout the day. So it depends on the degree of the pain that determines where the exposure comes from. If the pulp, the third layer, the innermost layer is exposed, that's where you have the blood vessels. If that is exposed, sometimes when you are just chewing, you have this pain that radiates to the head, headache. Some people come down with ear pain and other forms of pain. It may be an indication that there's a proper exposure. For, irrespective of what the exposure is, whoever experiences it should see it as important and see a dentist, because maybe something that can be solved. But if the person just keeps using medications or just using trying to do one thing or the other, use touch and go, use tooth powder, use this, use that, it may get so bad, and at the time the person presents at the clinic, it may be so bad that the person will lose the teeth and he will tag us as yoni yoni, and there's nothing we can do about that. So then for chewing stick, we don't discourage the use of chewing stick. There's this Ijebu chewing stick. I'm trying to remember the name. Is it Oriya? Yes, Oriya. So they have medicinal effects, but they don't have protective effects to the teeth. So we encourage that if you have to use a chewing stick, ensure you chew it soft before using it, and don't use it haphazardly. Use it like you are brushing your teeth, just like the way I demonstrated. And after, use your toothbrush and toothpaste, so that the fluoride in your toothpaste can give a protective effect. So it's not good to use chewing stick alone. It's good to use the two.
All right. My own question is the issue of not use water to rinse our mouth. Even some of us, after using water to rinse mouth, for some minutes, you will still be splitting. So now that you say we should not use water, how are we going to do that? That's my first question. And my next question is, you will hear some people, they say they have toothache, like gokoro. Some people will say, go and get shinap or something. Just put it and put that. Everything will go away. Is that the best? And secondly, what is the... Okay, on your lecture now, what is the function of mouthwash that they sell around at the chemist?
Thank you, Ma. The first question I wanted to ask, I think you've thrown more light on chewing stick, because it's already, I think it's facing out nowadays. We don't see people Then another question I want to go to is that is there maybe any way our dentition affects maybe any tooth issues? Because some of us that maybe have gapped teeth, or maybe because of that we have, or maybe people with closed teeth, they have, when eating meat, it gets stuck, and for one way or the other, for one reason or the other, they can't easily take it out. So is there any way it affects the tooth health of our oral health too? Then the other question I have is, there was a time I went for mouth cleaning. So after then, I was told to use a salt solution to gargle my mouth, and that's after getting home. So I don't know if it's something that should be regularly practiced, or if it's just one-off that should be done after cleaning, or if there's a way it could help. Maybe if we discover maybe anything like blood or maybe injury on the gums. Thank you, ma'am.
Okay. I'll start with the first question. So, it's possible, sir, to brush, spit, and not rinse. You will not get used to it in one day. When I started, so I struggled. But now I don't even think about it anymore. Once I brush, I spit out, I do not rinse. Some days I almost rinse, and that's fine. The way to go about it is, when you want to brush, you rinse first. After rinsing your mouth, any debris that is there, it goes. Use a pea size, or depending on how your bristles are like, just use half or quarter. I said the quantity is not important. Whether you use a smear, whether you use a pea size, whether you put from bristle to bristle, it will still do its function. But where the problem lies is when you fill your toothbrush bristles from bristle to bristle, you feel irritated because your mouth gets very foamy. It's just like when you wash clothes and you put a lot of soap. You rinse it. The first rinse, the soap is still there. The second rinse, the soap is still likely there. The third rinse, you have to keep rinsing until either you get tired or you just leave it down. Let whatever is left dry on the clothes. So that it is. When you use a lot of toothpaste, your mouth gets foamy and you can get irritated. So the trick is you use a little spit out. Try this night, sir. Spit out and rinse. Then the second question, sorry. Mouthwash, okay. Mouthwash is, everything still comes down to commercial and marketing stuffs. Mouthwash ideally should not be routine. Ideally should not be routine. If you are if you are cleaning well, you are rinsing well, you are going for your dental checkups, and you're having routine scaling and polishing, you only need a mouthwash. For example, when your immune systems are down and you have a mouth sore, when you have a sore in your mouth, maybe you have a itchy throat and you want it to gargle, those are the functions of mouthwash. But unfortunately, a lot of us use it every day. And mouthwash too has its own side effects. There are certain mouthwashes that contain some certain ingredients that can stain your teeth. So you're using mouthwash every day, and you realize that your teeth is getting darker and darker and darker. And you're wondering, you're not cleaning, I'm cleaning well, I'm doing this well. It could be as a result of your mouthwash. So it's not supposed to be a routine use. It's supposed to be used for wounds, itchy throats, sores, and the likes. Okay, those things, I call them loriro, because it does more harm than good. When you use, there's something called touch and go. Some people sell tooth powder. There's some people who say you should put aspirin. You realize that actually aspirin it burns the inside of your cheek, and you will even have more pain than you presented with. Those touch and go may look as if they work, but they will do more harm than good. Shinap, if you have a toothache, just the simplest thing you can do is to do a warm salt solution and hold it, gargle with it as a home remedy, and go and see the dentist. All those other things don't do anything. I've answered your question, sir. So as regards dentition, yes, your dentition can impact our oral health. There are people that have what we call, for example, the gap teeth that you make mention is something that a lot of us, especially men, guys, they love it. They see it as a beauty thing. But in dental term, is an abnormality. There's something that goes wrong in a place of development. There's a muscle around here called zygomaticus major. It's supposed to stay whole, but what happens is that it splits. So when it splits, it causes that stemma too. When you have the people that have dimples, we also love dimples too. Dimples is beautiful, but it's also abnormality. But they are harmless abnormalities. So let me make it clear. If you have dimples or if you have AG or diastema, they are abnormalities but can be harmless. But for diastema especially, they are in different degrees. Some people have it very little. Some people have a very big one. Like our former president has a large diastema. It can impact their oral health in different ways. Some people have malaligned teeth. If you see some people's teeth, you would see 1 ear, you see 1 ear, you see 1 ear, you see it all over. It could be as a result of their tooth development. For some people, oral habits. That's why as parents that have children, as much as possible, discourage children from sucking their fingers. If a child is still sucking after 3 or 4 years, the child is likely to have malaligned teeth as an adult. Also, there are some children that stick their tongues out. Some children like to suck their tongue. As it's doing all that, it's causing a pushing movement. Or you see some teeth, you see that the front teeth is up out, which you call proclined teeth, or Yoruba will say otasita. So all those, sometimes oral habits too has an impact on our oral health. So our dentition can impact our oral health, but it will impact it in varying degrees. So it depends on what it is that will determine if it will be harmful or it is harmless. I hope I answered that, sir. You asked another question. Okay, salt water, yes. The reason we ask you to do a warm salt rinse after scaling and polishing, for those that have extracted their tooth too, we ask you to start warm salt rinse after 24 hours. For cleaning is same day. Because we want to give a protection, we don't want microorganism compromisation. Our mouth is home to bacteria. The cleaning is minimally invasive. For extraction, there's blood and other things that comes with it. So we will not want microorganisms to seep into what has been done. So that the salts and the warm water follows this for those that have a basic understanding of science. It uses an osmotic. It functions with osmosis, so it dries out the cells of bacteria. So when you do that, you give a protective effect to your teeth. So that's the reason. It shouldn't be every day, but as I said, the best home remedy you can do when you have a tooth pain, when you have anything that is ongoing in your mouth, is to do a warm salt water. You'll be fine till you see your dentist. We should reduce the need to use antibiotics, because when you really need the antibiotics, it may not work effectively.
Okay, good morning, doctor. Thank you very much. At least today I've learned how to wash my teeth better. Thank you. So I have two questions. The first one, as regards teeth whitening, and where you have maybe the dentist place infrared in your mouth to do all those things, is it healthy? Is it beneficial? And if it is, how periodic do someone like me need to go for something like that? Then secondly, is it appropriate to brush your teeth in the morning after eating?
So teeth whitening is, so let me answer it so that I don't forget the questions. Teeth whitening is a cosmetic procedure. Is based on personal preference. Teeth whitening is not for everybody. Teeth whitening won't work for every tooth. This is what I mean. Some teeth are congenitally stained, meaning, for example, maybe a mother that took tetracycline in pregnancy at the time of a critical tooth development. When a child develops his or her teeth, there's this yellowish mark stains on the teeth. Teeth whitening is not for such people. If they do teeth whitening every day, that teeth will not whiten. There are other cosmetic procedures that can be done for that kind of person. There are some people that have this brownish, greenish mark stains on their teeth. It's not because they're not cleaning their teeth well. It's because of a compromise that has happened in the place of tooth development. Teeth whitening will not work for us. Who is teeth whitening for? People that take a lot of coffee, you take you like tea, you drink. For those that smoke, those that take bitter cola, those that take things that naturally the teeth absorbs the stains into them. The starting points for teeth whitening is to have a regular scaling and polishing. For some people, all they need to do is to just scale and polish their teeth and they are fine. For others, for cosmetic reasons, they would like to go further and do the teeth white. It is safe as far as it is done by a professional. We have beauty spas all over the place now, especially even in Ibadan now. And they do teeth whitening process. And I doubt it is done by a dentist. I don't know. So I will not be out to criticize them because I've never been one. If it's not done by a dentist, they may not understand the science behind it. And they may not do it properly. And if they do it properly, there are people that do teeth whitening every month. You shouldn't be doing teeth whitening every month. When you do a teeth whitening process, you should take, depending on the products that is used, because there are different products, you should take 2 or more years to do more. And if you are not a celebrity or you are not really a public person, I don't see a need to be doing teeth whitening over and over and over and over. And all these things are still comes down to some form of chemicals. If you keep repeatedly doing it, it can sometimes have a compromise to the teeth. So teeth whitening is safe as far as it's done by a professional, if there is need for it. Is there another question? Okay, brushing after, yes, ideally you should brush after breakfast. But many of us may not feel comfortable brushing after breakfast. And sometimes we may forget. So it's better when you wake up, you're having your bath, just brush. And if you remember, after eating, brush again. But it's better you brush after breakfast. At least if you are brushing at night, if you brush at night, you wake up. You will not wake up with an off smell. But if you wake up with an off smell from your mouth, you would not want to eat until you brush. But if you are doing morning and night, you will still wake up with a smell because you have closed your mouth all night, but you are not bothered about it. So you can just drink water, that cleanses it off, you can eat. But if you are not comfortable with it, just do what works for you.
We bless the name of the Lord for this hour. We are learning doing things right and doing the right thing. Thank you, Doctor. The second leg of the question my brother just asked is, when should we brush in the night? What I normally do is that after the whole activity, maybe before taking my dinner, I will brush. But from the look of things now, it's wrong. And if I say I will brush after the whole exercise in the day, I may slip off. So I don't know the time that is convenient. That's the first one. The second one is the duration of the brush we are using. Toothbrush. For how long should we use it before we discuss it? There are different brushes now. I don't know. Then occasionally, some people normally experience something like called blister in this place, in their mouth. We call it, the Yoruba we call it Ishiro. You see this oral something that is causing it, people normally say it's fever. But you see that this person is not affected by fever, and there's Ishiro in the mouth. So please clarify this thing. Thank you.
Let me start from the last one. I think I dwelled more on it in the first service. I mentioned it, that the mouth is a window of the body. So if, for example, you have a compromise to your immune system, you have been overworking yourself, your stress levels are very high, and your immune system is down. One of the presentations that can come is that blisters just at the lip here. And for some, it may heal off if they do certain things. Some people, the body just takes care of it. And for some people, they may break down and they may need to treat malaria. So it's as a result of compromise, mostly as a result of compromise to the immune system. Why there are other diseases that can present that way, but the commonest is when there's a compromise to your immune system as a result of high stress levels. Then, sir, as regards brushing at night. Brushing at night ideally should be after your dinner. The essence of brushing at night is you are taking off what you have eaten throughout the day. So if you brush before eating, you also need to brush after eating. And when you brush at night, that means after brushing, the only thing you are expected to take is water. If you eat biscuits, you have to go back to brush. If you eat donuts, you have to go back to brush. Unless which would just mean that you did nothing. You just ate, you brushed, you ate, and you just went to bed and you say, I've done night brushing. So ideally, as much as possible, I understand, sir, because of age, but if you like to brush before eating, it is okay. But after brushing, sir, before you fall asleep, you just brush immediately after. Then our toothbrush, we should change our brush every 3 months. Whatever form of brush you like to use, whether we use traditional brush, we use battery-powered brush, electric brush, we should change our bristles every 3 months. Or as soon as they are frayed, when you start seeing your brush in going north, west, east, south, it's telling you that you need to change it. You should change it every 3 months.
Praise the Lord. Emma Binu. The place of washing teeth with black charcoal for whitening, I don't know whether it is right or wrong. That's one. The second one, I don't know whether it is old age. When your teeth cannot close, especially this side, I feel that when I'm eating, it's only this side that the teeth will close together. But this one, there will be space. And I cannot see my teeth wearing off. So what can cause it? To the inside of the air. Thank you.
Okay, for the teeth that are not well positioned as they used to be, sometimes at the joints of our jaw, we have something called TMJ, temporal mandibular joints. If there's a little malfunction or derange, it can affect that. And one of the things that causes the TMJ to have a dysfunction is for those that yawn. You yawn excessively. When you are yawning, you just open your mouth. Ah. Or for those that, some people, their stress level, they have little threshold to stress. So when they are extremely stressed, it just deranges that area. There are other reasons, but those are one of the commonest reasons. It could also be that there's a compromise to your teeth. You may not be aware that is not making it align as it ought to. So it could be anything until it's assessed. Charcoal, okay. Charcoal use is not really, they market it as teeth whitening, but it does not do teeth whitening per se. Charcoal gives an abrasive effect. So for example, if you have a stain on your teeth from tea, coffee, bitter cola, it may take off that stain, but it will not do the whitening process to the innermost parts. Compared to when you use a professional teeth whitening kit, it would, the tooth is made up of 3 layers: the enamel, the dentin, the pulp. The enamel is a translucent layer. The enamel gives a reflection of what your dentin looks like. So it's the dentin that is whitened. So if the dentin is looking yellowish, for cosmetic reason, and you decide to whiten it, it would whiten, and your enamel, because it's translucent, will reflect what's the process that has happened. But unlike charcoal, I don't prescribe to charcoal. The reason is, we all know that charcoal could have health implications, and everything still boils down to marketing strategies. They come with their products and market it, package it nicely, that charcoal will brighten your teeth. Most of it falls down to Lorero. So that's what I will say. I will not badmouth anybody's product, but what it does is not like it's not bad, but what it does is just gives an abrasive effect. And if something gives an abrasive effect and you keep using it over and over and over and over, it can compromise the enamel. I hope I answered your question, Mommy.
We say thank you, Ma. Praise the Lord. It is time to give what God has blessed us during the week back unto the Lord. And I ask the usher to move forward.